Allston Brighton District City Councilor. We are here today with Boston Public Health Commission as part of our FY20 budget review pertaining to dockets 0622 through 0625, orders for the FY20 operating budget, including annual appropriations for departmental operations, annual appropriation for the school department, appropriation for other post-employment benefits, and appropriation for certain transportation and public realm improvements, as well as dockets 0626 through 0628, capital budget appropriations, including loan orders and lease purchase agreements. I'd like to remind everyone this is a public hearing being broadcast live and recorded on Comcast Channel 8, RCN 82, Verizon 1964, and streamed at boston.gov/city-council-TV. I'd ask everybody in the chamber to silence their electronic devices. We will take public testimony at various stages throughout the hearing. There is a sign-in sheet to my left by the door. We ask that you document your name, affiliation, residence, and please check the box yes if you do wish to testify. There are several ways the public can engage in this budget hearing process. You can attend a public hearing like today's and sign up. You can also come to a hearing dedicated to public testimony on Tuesday, June 4th from 2 p.m. to 6 p.m., and we will stay as long as necessary to hear everyone that would like to speak on the budget. You can also mail your comments to the Committee on Ways and Means, Boston City Council, 5th floor, Boston City Hall, Boston, Mass. 02201. Or email the committee at ccc.wm@boston.gov. I'd like to introduce my colleagues in order of their arrival. To my immediate left, my friend from Dorchester, City Councilor at Large, Anissa Asabi George. To my far right, District 7, Kim Janey from Roxbury. To my left again, far left, Back Bay colleague, City Councilor Josh Zakem. And to my immediate right, my friend from JP, Councilor Matt O'Malley, as well as my colleague from Roslindale, City Councilor at Large, Michelle Wu. I'd like to hand it over to you, Dr. Valdez, and thank you for all the work you do, and thanks for being here today to provide testimony.
Thank you, Councillor Siomio, and good morning, everyone. Councillors Asabi George, O'Malley, Councillors Janey, Zakem, and Wu. Again, for the record, my name is Monica Valdez-Lupi, and I'm the Executive Director of the Boston Public Health Commission. I'm joined this morning by our Director of Administration and Finance, Grace Connolly. It's a privilege for us to be here with all of you this morning to share the important work that we're doing across the Commission. We've been really diligent about our spending and have managed our resources in accordance with mayoral and organizational priorities. We'll present key accomplishments and future initiatives from 4 of our bureaus: our Child, Adolescent, and Family Health, Community Initiatives, Homeless Services, and Infectious Disease bureaus. Jen Tracy, our Director for the Mayor's Office of Recovery Services, and Devin Larkin, Recovery Services Bureau Director, will lead the afternoon session. Chief Hooley will present on Boston EMS next Thursday on May 23rd. The Commission works alongside Mayor Walsh and Chief Martinez and other city departments to impact the communities around us through youth engagement, community engagement, promoting safe and resilient communities, and supporting efforts to transition from homelessness to stable housing. Our Child, Adolescent, and Family Health Bureau addresses the physical and behavioral health needs of Boston's children, youth, and families. I know that violence has been front of mind for the City Council, so wanted to specifically highlight the work that we're doing around violence prevention. As you know, our Boston Neighborhood Trauma Team Network offers critical services for individuals, families, and communities impacted by violence. Through a network of 19 organizations, including community health centers, community-based groups, and a mobile team, we're able to offer access to our trauma hotline 24 hours a day, 7 days a week, 365 days a year, immediate crisis response services to any individual impacted by community violence, linkages to community-based support, support for individuals and families during community events, including vigils, memorials, and funeral services, and referrals for really important ongoing behavioral health services for individuals and families who are in need of continuous and long-term support for trauma recovery. In 2018, the network supported 73% of all gun-related incidents in the city and 100% of all gun-related homicides, with a total of 297 different response activities being completed overall. Thanks to additional investments from Mayor Walsh in FY19, we went from 5 to 6 neighborhood teams by adding a second team to Dorchester in the Grove Hall neighborhood. We were also able to build our capacity in data collection, analysis, and management for the NTT initiative. Also highlighted on the slide is the Family Justice Center, or the FJC, which is a commission program that partners as an initiative of the Mayor's Office and the Suffolk County DA's Office and the Family Justice Division of the Boston Police Department. FJC promotes coordinated and collaborative multi-agency services for victims of child abuse, domestic violence, and sexual assault. The team provides a safe and welcoming environment where individuals and families benefit from the availability of services offered by diverse nonprofit and governmental partner organizations. It acts as a hub of cooperative activity and facilitates continuous learning and serves as a resource center for professional development. And through their efforts, we're committed to coordinating violence intervention and prevention services that are culturally responsive and accessible to all victims. The Community Initiatives Bureau addresses health issues affecting Boston through community and home-based services. Programs support our commitment to community engagement, environmental concerns, chronic disease prevention and management, access to health care, and enforcement of citywide health regulations. Programs like the Mayor's Healthline, tobacco control, and chronic disease prevention work hard to deliver direct services to residents, and we're excited to relaunch the Summer Fitness Series with the Boston Parks and Recreation Department and Blue Cross Blue Shield. The kickoff event will be held on May 30th at Copley Square, and we hope that we'll see you there. The Homeless Services Bureau oversees a variety of programs that address the complex needs associated with homelessness. These services include emergency shelter, health and behavioral health services, job readiness and training, substance abuse treatment, recovery support, and rapid rehousing services. Last year, on average, we provided emergency shelter to 710 individuals every night of the year, which translates to 259,150 emergency shelter beds, 700,000 meals, 4,000 articles of clothing, over 1,000 clients who received intensive case management services, and 10,000 clients who received healthcare and medical services. We partnered with area shelters to ensure every person seeking shelter had a place to stay. This year, staff were able to place over 300 individuals in housing. This includes ongoing work to advance Mayor Walsh's plan to address homelessness by expanding the front door triage capacity rate from 33% to 53%. It's a top priority for us that our homeless guests not only have access to safe accommodations, but also dignified accommodations at both of our shelters. With funding from the city's capital improvement budget, we've begun making improvements to the Woods Mullen Women's Shelter, improving the space for both guests and staff. We're very proud of this work and that we've been able to do so far, especially the ability to increase our bed capacity. The Infectious Disease Bureau works to reduce the impact of infectious diseases, prevent sickness associated with these diseases, and create healthier lives for everyone. The team works to ensure that people have the necessary information to protect themselves from communicable diseases, and this means that they pay a lot of attention to providing comprehensive, linguistically and culturally appropriate information. Additionally, the staff provide funding and technical assistance to providers who deliver community-based prevention and education through comprehensive evidence-based interventions designed to raise community awareness and lower infection rates. The staff have been really busy working throughout the year on different outbreak investigations in the city. We do not have a measles outbreak in the city, but with the national focus on measles, The staff have been extremely busy developing advisories and, again, providing TA to other city departments. And I know we'll have a chance to go through and highlight some of that collaborative work that the staff have been doing. As we look forward to FY20 investments, we want to thank Mayor Walsh for his continued support and investment in funding important public health initiatives, and we'll highlight some proposed funding for new FY20 initiatives. Sexual health is a part of a person's overall health and well-being, and it's important to be knowledgeable about sexually transmitted infections. And this expansion in education and outreach around HIV and other STIs will increase early detection, particularly among hard-to-reach, high-risk persons who don't typically seek out care. We'll also be able to pilot a savings account program to improve asset development for homeless individuals by creating matched housing savings accounts, or HSAs. This is a model that's been implemented in other places, and these HSAs will be offered in this pilot for up to 50 individuals who are working with one of our case managers on a housing plan to move out of shelter. Clients will set their own savings goal for any housing-related activity and work with the case manager to ensure the goals are attainable and realistic. Accounts will be matched at a 3-to-1 rate of up to $500 per client. Since marijuana has been legalized, it's important to provide families, youth, and young adults with clear and easily accessible information about the health impacts of using marijuana. Thanks to an investment from Mayor Walsh in FY19, the Commission was able to work with Jen Tracy and the Mayor's Office of Recovery Services to launch a new communications campaign aimed at prevention messages for youth and other vulnerable populations, and you can see some of that work highlighted in the slide. Once again, Mayor Walsh has included funding in his budget to continue the support for this campaign, and as the work continues, we'll be able to analyze metrics from the rollout and train staff internally and provide training to external partners and provide additional information to make health-informed decisions. As you know, as the Health Department, we collect and hold important data and patient information. It's important to advance essential measures for safeguarding this information across our organization. To this end, there are 2 new positions that will be created in FY20. First, a new privacy officer, which is necessary for ensuring that we comply with our organization's privacy policies and procedures, along with state and federal privacy laws. The second position is an information security officer role to monitor our computer networks and to ensure that our IT systems are secure from cyber threats. We'll also join the City of Boston in moving our remaining server out of City Halls and the flood zone to the Markley Building at 1 Summer Street to ensure protection of our data center. I want to share that as an organization, we've launched our new 3-year strategic plan, which outlines specific ways that we'll be working to get at the root causes of health inequities among our residents. Building our internal capacity and expanding on the strength of the Health Department's programs will allow us to be more effective partners with the Mayor and all our community stakeholders in the City Council. Related to our priority area for strengthening collaborative partnerships, we've joined Chief Martinez and other HHS cabinet departments in a collective impact planning process to better align our work and to be more intentional about the impact for which we're striving. We've developed a plan that identifies BPHC efforts that can contribute to housing stability by working to remove barriers that prevent our residents from getting the resources that they need to attain housing stability. In closing, we want to thank Mayor Walsh, the team at the Office of Budget Management, and Chief Martinez for their support. I also want to thank our Board of Health for their continuing guidance and leadership during this budget process. We've worked really closely with our members in preparing our FY20 budget and are grateful for their commitment to ensuring that as an organization that the Commission is able to continue to build on and improve our public health services. I also want to thank all of our staff for the outstanding programs and services that they deliver and provide to all Bostonians, and we are really looking forward to working with all of the City Councilor members as we move through this fiscal year. And so now I'll turn it over to Grace Connolly to continue our remarks.
Good morning.
Good morning.
Just as a quick summary, our proposed total budget for FY20 is $179 million, which includes an appropriation request of $89.7 million, anticipated revenue funds totaling $45.5 million, federal funding at $18 million, state funding approximately $16.4, and then miscellaneous, inclusive of foundation grants, fees, et cetera, of $9.4 million. The total Boston appropriation has increased by $3.8 million, or 4.4% over FY19. And the FY20 budget does include collective bargaining increases for all but 2 units at this point. And our proposed total FTE count for FY20 is 1,185, an increase of 17 when compared to FY19. The FTEs supported through the appropriation are approximately 941, and the increases relate to infectious disease, ITS, the General Counsel, Recovery Services, and EMS. And then in addition to supporting services through the operating budget, the city's capital plan has included new funding for several critical projects, including a new roof and electrical HVAC work in the Miranda Kramer South End Fitness Center building, Woods Mullen bathroom renovations, recovery projects that are continuing in relation to the opioid epidemic, an EMS Seaport Station, and UPS installation and replacements that our ITS department will work on with the Department of Innovation and Technology. Operating and capital funds will be used to continue to support core public health functions that promote the health and safety of residents, workers, and visitors in Boston. And our spending decisions are all guided by our operating principles, where we engage the community, use data and evidence to guide decision-making, and build partnerships within the city. Thank you.
Thank you. And shortly after you started your presentation, we were joined by Councilors Ed Flynn and Andrea Campbell. Well, thanks for your presentation. Let me start off the questions. Can you be specific, more specific maybe, on the 17 new positions? I think you mentioned EMS, but, if you could highlight, what divisions they're in and what their duties may be.
Absolutely. Infectious disease will be adding an epidemiologist to work on HIV, HCV, and they'll be in the field. So ITS will add the information security officer. The General Counsel will add the privacy officer position. Recovery Services will have 9 additional FTEs, and EMS has additional 5 FTEs over the FY19 budget.
And let me remind folks that we are having a separate EMS hearing next Thursday at 10:30, so most of the questions should reflect all the other programs, I guess, to be more specific. I was looking at the capital, and it looks like you started the Long Island study. Do you have any updates on any findings in, I guess, phase 1 is underway of the study, of the facilities and such?
So I think in terms of the Long Island study, we'll defer to Jen Tracy,
Okay.
who will be here right after our session.
Okay.
Jen and Chief Martinez are leading our Long Island work for us.
Okay, great. So, and again, I know we're going to talk about EMS on Thursday, but as I go down, the allocations, just wondering if the under 2% increase in EMS, does that reflect the contract we just actually approved yesterday?
It does not yet.
Okay, so that will come up, or are you projecting with that in it? Do you know?
I think we projected it in it, but it's just a
Okay.
projection at this point.
So I guess I'll just put it out there that kind of troubles me again, because I know, response times I hear are, getting better, but still I don't think that they're where they need to be. So I just want to make note of that. Let me recognize Councilor Asabi George.
Thank you, Chair, and thank you both for being here and your thoughtful presentation, your thorough presentation. First, I just want to thank you for the Health Commission's partnership in what I organized a few weeks ago, the first citywide Needle Take Back Day, with certainly in partnership with the Health Commission and our community health centers across the city. Thank you for that, and I look forward, we're sort of digesting some of the results of the day and look forward to celebrating that and hopefully planning a repeat Needle Take Back Day. So I want to, preference, you started with it in your presentation here, mentioned the measles concerns across the country, and that we have none in the city of Boston. Can we talk a little bit about the infectious diseases that have been talked generally, and as a parent, I'm worried about, I think about measles, mumps, I think about rubella, of course, when we think about MMR, but then also, most recently, we had an active case in the city of Boston of tuberculosis. Talk a little bit about the concerns that the public has and the response of the Health Commission.
Sure. Thank you for that question, and thank you again for your leadership. It was exciting to see your vision actualized in the Needle Take Back Day, and we're really happy that we were able to partner with you on that effort. And I think you're raising a really good question, and I think as a mom, and I can relate to what you're raising, and I think given that it's been front and center nationally, we can't get through a day without hearing about measles and the outbreaks that are going on throughout the country. Before we came this morning, I wanted to double check the numbers so that you had a context and frame of reference. So the CDC does a weekly report out on the cases of measles, and so as of this week, which covers January 1st to May 10th, as to date, there are 839 individual cases, which is up from the previous week, 75 from the previous week that they reported. The majority of those numbers I will share with you, you've probably heard in the news, have been isolated in certain geographic areas. So a couple of weeks ago, our colleagues in New York City had an active outbreak in Brooklyn among an ultra-Orthodox Jewish community there. There are also active outbreaks, very large outbreaks, happening in Washington State. We are very lucky to be in a state and in a city where we have nearly universal vaccine rates. So in Massachusetts alone, we have a 98% vaccination rate. I was on a call last week with colleagues, and San Diego was the second city on that call. I think she said that they're at 93% vaccination rates for MMR, which is the mumps, the measles, and rubella vaccine that you referenced, Counselor. The question about those different diseases, I can start if you'd like, about how we keep track of the data, because I know that was one of the first questions that you had inquired about. And this is actually led by our state colleagues. So the State Department of Public Health is the agency that operates an immunization registry. So this is the Massachusetts Immunization Information System. And all students entering school in the Commonwealth are required to be vaccinated under state law. So the first thing that I wanted to raise is that it's under the state's purview to track this data. There are limitations, and so I wanted to raise two limitations in the state system, and really this applies to much of the data that we collect in public health. The data are only as good as what comes into the system. And one of the limitations in the immunization record system in the registry is that it's received from healthcare providers directly. So the healthcare providers input it directly into the system, and they don't often have the historical records when particularly new students are coming on board into the system. The second limitation is that and this is, it's a good thing in the state that we actually, as of June of 2017, qualified pharmacists and pharmacy interns are also authorized to administer CDC-recommended vaccines, which includes MMR, to individuals who are 9 years and older, but not all pharmacies in the Commonwealth are connected to the registry, the system that I described. So if they're not connected, but they're getting vaccinated by a pharmacist or a pharmacist intern, that data isn't necessarily going into the system. So those were limitations to the statewide system. The second database—
Can I ask on that the statewide system, are our school nurses linked into that statewide system as well?
Yes, so the schools, local public health, school nurses, and providers are linked into the system.
And are all of our community health centers in the city of Boston connected to that system?
I can confirm that for you, but I imagine that they are. But before I say that all of them are, we can double check that for you.
Thank you. Go ahead, continue,
Yeah.
sorry.
So the other database, or the other way that we track immunizations in the Commonwealth, is through an annual immunization survey that DPH administers for kindergartners, seventh graders, child care providers, and college students. And at the national level, obviously CDC is the one organization that also tracks immunizations, and that happens through their National Center for Immunization, for the Center for Immunization and Respiratory Diseases. You asked about data regarding measles, mumps, and rubella, and so we don't have data available at the time of this hearing on 2019, and our staff will be looking at that data to make sure that there aren't any privacy concerns before we share that with City Council, so we can provide that. We're going to confirm that we're able to do that. But I have data available for 2018 for you. And again, measles, we had 0 cases of measles in the city. We had 11 cases of mumps, and then 40 cases of tuberculosis, and that's down from 82.
And that's active TB.
That is active TB.
Great. We do 5-minute rounds of questions, and
Okay.
the timer went off, although it was on silent mode.
Yeah.
So I'll save the
We'll come
rest of
back.
my questions for the next round. Thank you very much.
Counselor Zachem.
Thank you, Mr. Chairman. I was encouraged to hear about our vaccination rates in the city and the state. That was one of the questions I had. And just to follow up on that, is there any indication that that's trending in the wrong direction? Are we holding steady? We think we're in good shape there?
You know, I think the one thing that, I think that 98%, nearly universal vaccination rate is one of the steps that, or one of the factors that we have in the city and the state that make us very different and set us apart from those other jurisdictions and other cities that you're hearing about in the news. Because we have so many people who are, and individuals who are vaccinated, we have what's described as herd immunity, which means that even if there were a case of measles in the city, that's the majority of the population has been immunized, so we'd be protected. Obviously, we should always be striving for vaccinating everyone, but you're right. I mean, I think that really sets us apart.
Excellent. Briefly on Long Island Bridge, I know that's going to be covered more extensively in another hearing, but from an A&F standpoint, do we, does the Health Commission, do our shelters, our services, do we keep track of where folks come from when they're receiving services from the city of Boston? So I know they're coming from Quincy or Milton or Worcester or wherever they're coming from.
We do the front door triage as someone's entering the shelter. Figure out and try to divert them from the shelter. We want their stays at the shelter to be brief, but yes, we do have that information, and we know we've talked about it in previous years that many of them, more than half, are coming from other cities and towns.
No, and I think that's obviously a testament to, I think, the services that your department, the City of Boston, provides to people, but it also is an interesting data point in the current discussion with the city of Quincy about rebuilding Long Island Bridge. And this is a shared regional problem that every city has a role in, so it could be useful to have that data to share with them, perhaps send them an invoice at some point if they continue to be obstructionist about rebuilding this bridge. So thank you for that. That's all. Thank you, Mr. Chairman.
Thank you. And we've been joined by City Councilor at Large, Michael Flaherty. Let me now recognize Councilman O'Malley.
Thank you, Mr. Chairman. It's, I think, unsurprising that the sort of lead line of questioning from my colleagues and me is about vaccination rates, so thank you for going into it so thoroughly with Councilor Sabi George. I'm reminded of really a high point professionally was when The Simpsons came to Boston. It was an episode they did a couple years ago, and Marge Simpson discovered one of our sunscreen dispensers. And she said, "Free sunscreen, how progressive." And then another woman was walking by, and Marge said, "Excuse me, do you vaccinate your children?" And the woman said, "Of course." And Marge Simpson said, "But not stupid progressive." So I appreciate and am heartened by those rates. Hope there's more we can do, and hope that other municipalities truly take Boston's lead as it relates to the importance of immunization, the science behind it, the life-saving efforts that we need to do for our children and for our society. So good work there, and I know we all stand committed to working to continue those trends. Thank you, Executive Director Lupe, Director Connolly, for your great work. It's great to see Chief Martinez and Chief Hooley and Mike McNeil and his team from the Men and Women of Boston EMS. I know we're having a separate meeting on that, and I'll get into my line of questioning around EMS then, but suffice it to say, one thing that I need to see in this budget is a real commitment for some permanent facilities for paramedics and EMTs. We've put money in the 9 budgets I've been here for studies, for reports. I need to see some more follow-through. We need to make sure that these incredibly hardworking, dedicated professionals, who I know we all value, have a place where they can park their ambulance, where they can sit and take a 5-minute break, which is rare in any given shift. So we really need to make sure that that happens through the capital process, but we'll get into that on Thursday or next week. Director Lupe, yesterday, Councilor Sabi George and all of my colleagues here co-sponsored an initiative looking at teen e-cigarette use, juuling, vaping, et cetera. We've seen statistics that would suggest nearly 1 in 5 high school students use electric cigarettes. We're seeing the number of middle school students increase by dramatic numbers, the percentage doubling year after year from 2017 to 2018. Can you talk a little bit about some efforts that you're currently doing, recognizing the fact that we will be having a hearing, and see other ways that we can support you and other strategies we can employ?
Thanks for that question, and thank you for your leadership on the sunscreen and this issue as well. This is actually an interesting topic that we talk a lot about internally, because it is, our colleagues at the State Department of Public Health have a full-on campaign.
Yep.
They're seeing dramatic increases in e-cigarette use and juuling in other regions and other municipalities in the Commonwealth. And what we've seen in Boston in the data, and I have this as one of our progress points to highlight, is a decrease in the Boston Public High School students that reported using e-cigarettes, and it went from 15% in 2015 to 6% in 2017. I had the staff double check to make sure that that was the most current, and it is, and that's a dramatic decrease. We attribute that to the work that the Commission has been doing over decades in terms of very robust and strong tobacco control policies and regulations. In 2015, our Board of Health amended our tobacco regulations. We were one of the first cities in the state to raise the age for purchasing tobacco products to 21. We took that additional step and restricted the sale of flavored tobacco products. The state followed in terms of tobacco 21, but we still remain on the list of cities in the country that has very progressive and very robust tobacco control regulations. The one piece that I know that you put front and center is menthols, and for us at the Health Department, this is an issue of health inequity because we know that big tobacco has been targeting our communities of color, and that's how they have been able to hook most recently that next generation of smokers in terms of having menthols and other flavors. That's why we've seen that improvement on the flavor on the high school use. I can share with you that we're actively now in planning discussions with Chief Martinez and the mayor and our board to look at how we can make our regulations even more robust, and we look forward to working with you.
So that's very heartening to hear, and I certainly take you at your word. It seems completely counterintuitive to statistics happening throughout the rest of the Commonwealth, where it's about 1 out of every 5 high school students. Is that 6% number self-reported?
It is self-reported. So
and the question is, as I understand it, the way the question was phrased was a little different. It was, if I have this right, it was asked the question was posed to middle school students. Have you used electronic cigarettes? And that actually was a higher number than high school students. And in high school, are you currently using?
we can double check on the way that the question
Yeah, that's the way I
asked.
read it.
Okay.
So I think, but suffice it to say, it sounds like there is some good work happening there. I just always think there's more that we can be doing, and I want to make sure that the figures that we're relying on are indeed accurate, but
And I
appreciate it.
definitely think that there is, regardless of that improvement and the progress that we have seen, that we have to remain vigilant when it comes to e-cigarettes,
Yeah.
because we have heard anecdotally that there are some schools where it is quite pervasive.
Yeah.
So happy to work with you on that. We're really looking forward to it.
Me too. Thank you both. Thank you.
Counselor Wu?
Thank you. Good morning. Thank you for everything that you're doing across the city and all the data. Very helpful. I wanted to use my time on lead poisoning. And just as a constituent, and some others have brought the issue that Massachusetts has very low standard, well, I guess defined high thresholds for intervention and triggering city government and others to go in. So when I was speaking with Commissioner Christopher, and he alerted me that you all, the ISD and the Health Commission have a partnership when it comes to issues of lead, and that you all take primary responsibility when it's young children. So can you just tell me a little bit about how the inspection program works and what the resources are available for that?
Sure. So I can tell you what we've been doing in partnership, actually with schools and ISD. So in 2016, Boston Public Schools water access policy was voted on by the school committee, which ensured that all students had to have access to water throughout the school day at no cost. And there's also a component around annual testing of schools that have supplies for water for consumptive use. BPS follows the EPA's revised guidelines around testing for reductions in lead in their drinking water in schools and childcare facilities. And so when there is an event of a drinking water fountain that is above the allowable range or rates, that water fountain, we work with the schools. That water fountain is taken offline and replaced with water dispensers. We work with BPS in terms of communication protocols and how we notify families and staff. Any school, once the repairs are done that are scheduled to come back online, they have to have 3 consecutive tests that are done on the water samples, and the results have to be below the EPA lead and copper action levels. And schools, again, they follow the state rules around sampling protocols, and so they do that approximately 8 to 16 hours after they've used it. They've been committed to partnering with us, and we've supported them in testing their water fountains in all of their online school buildings on at least once annually. And they're the topic of lead and their water policies is routinely discussed at their district wellness council meetings.
Can you talk a little, sorry, I just have limited time, so I have had conversations with BPS on the water and lead issue. I'm interested in also learning about the just paint and in terms of housing inspections, as what I'm told is that there's actually much higher incidence of lead poisoning from kids living in homes that might have lead paint exposure, et cetera.
And we can give you that data and the procedures offline, but yes, because of the higher the housing stock in the city.
So what happens now when, because ISD told me that it's BPHC that goes in and actually does the lead inspections.
We do the lead inspections, and then we have funding to help with remediation, and so we work with the families in terms of lead testing if it does come up positive in those results, and we can share that policy with you and how it works.
How many inspectors do you have?
Actually, don't know that answer off the top of my head, so we can come back to you with that.
And also curious about what the exact trigger points are for BPHC to send an inspector out.
It's based on the blood lead levels and the test results that come back to us, and I'd have to get back.
For example, from the pediatrician side, or when does it come in through the housing ISD side, and when does it come in through some sort of public health?
I'd have to follow up on that
Okay.
because I want to make sure that we're giving you the correct answer in terms of how that process flows, so we can get that. to you.
Okay, it would be great to understand kind of the scope of resources that are available for responding to particularly lead in homes, that issue, and what it would mean if the standards were, I want to say heightened, but if the level of exposure that triggers an inspector to go in were lowered to the national recommendations, which is much lower than what Massachusetts currently has. So just wanted to understand kind of what additional, what that would mean in terms of the day-to-day of the Health Commission needing to go out and then follow up. And then what happens when you do go into a home and you find some condition that is threatening the health of a young child, what kind of follow-up is there and what resources do you put to that?
I just double-checked, and it's the water testing, so.
Yeah, okay,
We'll
you go
get,
for it.
we'll get it to you, though.
Thank you.
Counselor Flynn.
Thank you, Councilor Siamone. Thank you to your leadership on so many public health issues facing our city. I had two issues I wanted to focus on. I know you referenced earlier the Seaport Station as for EMS. That's something that I'm interested in. I do get a lot of residents asking me about it. It's a booming, growing neighborhood. There isn't a EMS presence there. I am afraid that, you know, if there's a major incident there, it's difficult getting EMS into the Seaport with the ongoing traffic. I know there was some money allocated for Dry Dock Avenue, but can you give us a general idea of what the process has taken place, where are we, and where are we going?
Yeah. Chief Hooley is actually here, and perhaps he could come down and answer that specific question about the Seaport Station. I don't
Okay.
have the details right here.
Yeah. And I know that was more for the capital budget process, but I know you referenced it earlier, so I just wanted to follow up on it. Thank you, Chief.
Good morning, Council.
Good morning, Chief.
Councilors, Madam President. Thanks. I wasn't expecting to sit here before Thursday, but happy to be here.
Okay.
Just in case.
Yeah.
And, specific to the request for the Seaport, just you know, historically, we've had a request in to, you know, among other places, to prioritize getting some sort of station or facility, satellite, whatever you want to call it, down in the Seaport for many years now, going back to even prior to, I think, Mayor Menino's last term. It's 3 years ago, I believe, the city did invest in a study on that. They did conduct that study. They did a needs assessment. They weren't able to come up with any siting. They made a couple of recommendations looking at other cities, how they would do things in areas like that that were rapidly developing. One was to build something on city or whatever owned land. Two, maybe try to partner with other agencies like, you know, the state-owned stuff down there, convention centers down there. And another one was to do some sort of linkage program. And they showed examples of different ones where different cities, somebody's putting up a new building and they, part of the development thing is you carve out and put a station for a garage in for a fire truck or EMS or whatever. They gave different examples. So they sort of just showed out different recommendations on that. This past year, BPDA has been trying to keep an eye out on city-owned parcels down there that weren't necessarily, you know, slated for development or potential development, where you wouldn't want to put something in and only 2 years later find out that the area is being, you know, sold if there was a plan. So this past winter, we were contacted by BPDA that they did have a small parcel with an existing small garage on it down at, I believe it's number 30 Dry Dock Ave.
Yeah, 30 Dry Dock, yeah.
And that, you know, would we consider it? And, you know, of course, said yes. That was the first anything we've heard in like maybe 10 years on that, even though the city's been looking. There's been talk of other developing other sites down there, building a combined facility with the harbor unit for the police that would include us, but I'm not sure where that is, and I'm not sure where that. So right now, this seems to be the first tangible. As you know, on the capital thing, getting siting is often very well. Getting consideration and getting it in the plan is the most important thing, and doing the study, but. Citing helps because that means that you can now move on to design if they agree. And that's what I believe the 325,000, I think, change was in the budget this year, was to start on the idea of some design. I know that I was told that, was it capital property, not property management, property construction, capital construction, they went down to do some assessment on the site and said that it was, they were looking at it to see if it would be something that could be remodeled or just, leveled and something new built in, and that those some of the options, and I believe that's why there was money put in the budget this year that I was told would be available as of July 1 for them to start doing preliminary planning for construction.
No, that's very helpful, Chief. Thank you for that input. I know I have great respect for the work you guys do. My only concern is, it seems like the closest station might be Oliver Purchase Street, and then certainly at C6 in South Boston.
Correct.
I am concerned about, traffic and not having a physical presence down there. With the growing population in the Seaport and the Fort Point area. So I'd really love to see a station down there for EMS. I think it's needed, and I think it would benefit the residents of that community down there.
No, we agree, and we identified that area as the fastest growing. Call was 15 years ago.
Yep. No, thank you, Chief, and I appreciate everything that you're doing for the city.
Thank you.
Thank you.
Thank you. Councilor Campbell.
Thank you, Councilor Siomo, and Monica and Grace, thank you, and Chief as well. Just wanted to echo Council O'Malley's comments with respect to stations for EMS, paramedics, and technicians. I agree with him. But just curious, we have, and it was actually a project that started before I even joined the council on River Street, the EMS location. Is that a location where technicians and paramedics can come back to and sort of take that 5-minute break, or is it just used for, Chief, come back. Grace is like, come back. Or is it just used for storage of the trucks and stuff like that? I've been there, and I've toured, actually did a drive around with Chief Hooley, but I'm not sure if it serves that purpose as well.
And I should have asked permission to be excused or dismissed. Sorry.
Yeah.
So specific to the River Street facility, the garage, that was built a few years ago. That was a capital construction project. It's got 11 bays, and each bay is like 2 bays, basically deep enough that you could put ambulances back to back. We store some of our larger stuff there, like our disaster, the bus, spare ambulances. We have a large communications trailer that we stored that we had to use this winter. We also have basically the support for the city's USAR team. Their collapse rescue trailer is stored there as well as a tractor to move that around should that be needed for a disaster in the city or in the region. Actually, we do currently staff and operate a few ambulances out of there. One is ambulance 19 from Mattapan, for ambulance 12, which is a zone impact truck for Dorchester, which generally posts up around Franklin Park, and ambulance 17, which, believe it or not, is a Rosendale truck, zone impact. We don't currently have a station or a garage in Rosendale, so the crews for ambulance 17 report there. pick up the ambulance, they park their cars, they have equipment secured there, jump in the truck, and then head back up to Rosedale. At shift change, they travel back there, and then their evening crew relieves them, and they go out. Ambulance 12, same story. They go up to Dorchester, and they help fill in areas of Dorchester over there. I mean, Dorchester is pretty big, pretty popular, so they fill in when some of the primary trucks over there are busy. And they also back up Roxbury as well. Ambulance 9, so ambulance 17 and 12, no, they would not routinely be able to go back there except to, start or
Okay.
damn their tour there.
And shifting.
Ambulance 19, which does cover Mattapan, that's close enough that, they can go
Okay.
back and use.
Well, I wanted to just go on the record of, and we can talk about this more in the
Yes.
EMS budget hearing, as supporting Council O'Malley's comments with respect to more facilities for paramedics and technicians to have this space. I will tell you, out of many of the projects that I followed in my district in terms of construction design, that garage was, I think, a really great example of community process. Folks had responses on color and change in EMS, and the Health Commission responded accordingly. And now you have a garage that people have welcomed, obviously, received well, and does really great work. Not the garage itself, obviously, but the individuals going there do really great work out of that facility. So just wanted to acknowledge that. I have just a couple questions before probably this round ends. Mental health, I know Councilor Sabi George, of course, want to give her credit, given her the committee she chairs for the council, has done a lot of work in this space. It has been coming up quite a bit with respect to some meetings we've been holding in District 4 in my district called Constructing Peaceful Communities. And I have to thank you, Monica, as well as your team members at the Health Commission, as well as Chief Hooley and others who show up to those meetings. They offer incredible insight, are very responsive. And it was a meeting that was set up in response to incidents of violence in District 4. But we wanted a consistent space that anyone could come to, but also brainstorm collectively what we could do to respond to incidents of violence, not, assuming that only a counselor or EMS or police or the Health Commission can do it all alone. We have to do it as a community. So your team members show up, they participate, and it's extremely helpful, including in our first listening session, they showed up as well. And in the second meeting, they showed up in full force. So wanted to acknowledge that. But one of the things that has been coming up quite a bit is the importance of focusing on mental health and the trauma that folks in certain communities are exposed to, and often don't necessarily seek the supports or care they need in addressing those that exposure. And I guess have maybe two questions, and I'll end with that. Is something came up around the month of July, and July being Mental Health Awareness Month for minorities. And I called health centers, I spoke to various folks at different hospitals, and I was shocked because no one knew what we were talking about. I know it exists because we've done a little research, and the U.S. Department of HHS, it's on their website. They do some work. I'm not sure how deep or far they go in the work, but curious if the Health Commission does anything in July to recognize this month as Mental Health Awareness Month for the minority community. And if not, would love to continue a conversation with you and your team, probably pulling in Councilor Sabi George as well, on what we could do to raise awareness, particularly around the numbers of folks dealing with mental health issues and the stigma that still exists, particularly in communities of color, immigrant communities as well.
So I can double check to see if we have anything scheduled in the month of July, and would really be delighted if we don't,
Okay.
to work with you on that.
And I'll pull in Councilor Sabi George. I'm bringing this up now because I was just surprised that no one really knew anything about it. so we can follow up offline.
Yeah, the other thing that I would say that I have appreciated is your willingness to partner with us throughout the year, not just in the month of July and when things are really spiking during the summer and fall months. And I'm not sure if you recall, but last summer, over the summer months, the commission worked with our Youth Advisory Board and our Child, Adolescent, and Family Health, and we have our Bureau Director, Ann McHugh, who's sitting back there, and Catherine Fine, who you know leads our violence prevention work that sits within the Bureau. And last year, that our summer community dialogues were they were totally designed. You came to one in Mattapan, and that was completely designed and led by our youth and our young people. And the focus was on the impact of community violence on adolescent mental health. We had nearly 500 young people who came out to almost a dozen different community-based hearings. And I agree. I think that there is still a lot of stigma in the community, despite the services that are provided not only through the commission and our extensive network of community health centers, but would love to follow up with both you and Councillor Sabi George offline to see if there are some specific things that we can do as a follow-up from the dialogues we had last summer and connect it back to the continuing work that we all have to do in terms of strengthening the resiliency of our communities of color who really are suffering from a lot of the chronic exposure to violence and toxic stress. That impacts everything.
Awesome, thank you. I can wait for the next round.
Thank you. Councilor Flaherty.
Chairman, good morning. Executive Director, Director-in-Chief. I do have a Bragdon Street question, so don't go anywhere. Have a seat. So it's good morning. Good to see everybody. Anytime I get a chance to talk about public health issues, I like to brag about our community health centers.
Yes.
The network of community health centers we have here, I think, are second to none, and how they interact, particularly their executive directors with this council, as well as all of our respective communities and neighborhoods across the city. I think it's a city treasure for us. They're also servicing some of our most vulnerable residents. So not sure what that interaction or what your thoughts are in their status, but are we providing them resources? If so, which ones? And if not, how can we get plugged in with them?
So I'll start, and Grace can find some of the figures on their line item.
Sure.
I don't know if you know this about me, but I actually started my career here in Boston working for Jim Hunt and Pat Andreas at the Mass League in the late 90s. And so that's how I came to know about the health department. And so that relationship between the Boston Public Health Commission and the Mass League and the Boston Conference of Community Health Centers in particular, I staffed them when I was at the league, runs very deep, and it's grown over time. I can't think of any public health work that we do, even with things like EMS, capital improvements, that our executive directors haven't partnered with us on. So they really are, as you said, a treasure and something, again, I hate to say, I sound like a broken record, but it makes us unique in terms of the extensive network of health centers that we have and the public health infrastructure that they contribute to. They receive, as you know, grants. They're partners on the Neighborhood Trauma Team initiatives. They also receive funding from us through different competitive RFPs. So, for example, with our Ryan White Part A grant, which is a federal grant that we receive around HIV treatment and care, health centers receive grants through that process. They've responded to a new round of funding around sexually transmitted infections, hepatitis C, and other STIs. That's city funding, education and outreach. I think I flagged that in my remarks. And so there's federal funding, city funding that we procure, and then there is a line item that they've had dedicated to community health centers, initially focused on maternal child health. But I'll allow Grace to give you the exact figure on that and some improvements that we've made in partnership with the Boston Conference.
So we dedicate $3.6 million to the community health centers for grants. And as Monica mentioned, this was previously devoted to primary care and infant mortality. During FY17, we started a discussion with the Mass League about how to transform these grants so that they could better reflect what the individual community health center needed. So beginning in FY18, they were allowed to take what they had and direct it towards their particular needs for their community health center, and they would give us a report back. We also changed how we did the billing to make it less burdensome on them. We've transformed it essentially into a real grant program. They receive quarterly payments. We get an annual report, and we just have some preliminary data from the prior years, and some are continuing for primary care, infant mortality. Some have actually branched out into mental health work, translation, so they're actually reforming them to how they feel they could best serve their communities.
Great. I think they're a jewel for the city, so that oversight, obviously, and making sure that they remain sustainable is huge for us. The other area I'd like to talk about is our EMS. I led the effort on the council to secure Group 4 for them several years ago. They do phenomenal work. You think about senseless violence in our city, I think the death toll would be significantly higher, possibly even double, if not for our EMS and if not for one of the best trauma units just minutes away from where a lot of this violence is happening. It's at Boston Medical Center, so they do phenomenal work. Our population's growing. Traffic congestion in construction continues to increase. That's slowing down our response time, so just want to make sure that our EMS are respected and that they seem to always be kind of like the forgotten one, sort of in our public safety tree, if you will, making sure that we're putting enough on to sustain the department, making sure that we're adjusting to population growth, but also making sure that they're properly stationed across the city is huge. I think Bragdon Street, I think it's time to have a serious conversation about buying Bragdon Street. I know it's centrally located. I know we consistently have a lease that I look at, budget in and budget out, but all emergency personnel use it, EMS, Boston Fire and Police. And it's leased. I know it's somewhat antiquated. It would be great if we would consider purchasing that site because of its location, and then really putting a public safety campus there, if you will, in the event that we ever actually have to activate it for a serious situation. And I know that we have activated in the past. So thoughts on Bragdon Street? We're going to continue just to do a lease, or should we approach the owner and secure it and put it into our portfolio as an asset, a real estate asset for us, and a public safety asset for the city?
Chief, do you want to talk about Bragdon Street?
Yeah, no, thank you. So I believe we have another 2 years to go on the existing lease. I know we renewed it last year. We've been there probably at least 13 years now. And similar to Brighton, similar to where we lease property from Harvard currently, and Shirley Street in Roxbury, where we lease a large facility for our central fleet. Yes, obviously, great to be sitting somewhere where the city or the commission was the landlord, where we're not necessarily facing you're responsible for a triple net lease and for and then all the repairs on top of it and the maintenance and the prospect of every 3 years when the lease is up to have the rates jacked up on you again. I do know that with the EOC, Mayor's Office of Emergency Management, co-located with us at Bragdon Street, that has helped defray our cost on that, because for the last probably about 5 years now, there's been money in the budget from them to help pay for sharing that facility with them. So that has helped us operationally at Boston EMS. I do believe, and here's why I would have to go back and check the facts. I know a few years ago there was some interest by the city to explore that when Renee Fielding was the director there, and I believe there was some talks back with the company, and I'm not, or the owner. I'm not sure where that landed with a willingness to sell, to the point where the money was, well, the cost of whatever was being negotiated or explored and stuff at the time, that was being done through her office. And my understanding was, at the time, the city and the owner really couldn't come to terms. That I guess they're pretty far apart on what each valued the land at, especially with knowing that they'd have to do some extensive work on the building once they did procure it. So I'm not sure who would be, if it would be property management and capital construction, somebody else could even just explore something like that, because then that way the city, the council, us, everybody has options.
Yep, no, I think that's a great idea. I know that since that time, I think the owner has passed, but but with 2 years on the lease now is probably the appropriate time to knock on the door and see if there's an opportunity for us to to do something that makes sense for the city. And I would love to secure that as an asset for the city, an asset for our public safety team, and make the necessary improvements at that site, again, it's in the epicenter of the city. And it's between the networks and also with the communication piece, a significant communication infrastructure was undertaken there a few years ago at great cost to the taxpayer. We want to make sure that we're sort of holding on to money that we've spent in that facility, but it just makes sense from my perspective, and would love to see someone, particularly maybe in the public health side, continue to push that idea or that issue that instead of just continuing to pay a significant portion, significant amount of funds every year in a lease, maybe we talk about purchasing it.
Thank you.
That might be a good sense, so I appreciate it. Thank you, Mr. Chairman.
Thank you. I'm going to go to a couple of folks for public testimony. Anna Leslie and Emily Baker. Or Emile. Yep. Sure.
Thank you, Counselor, because I didn't actually check the box, but you were reading my mind. Thank you, everyone. I just had a question. I know, sorry, I'm Anna Leslie. I'm the director of the Alston Brighton Health Collaborative. And I know there's quite a bit of funding that's been available, is coming available through hospitals. We have a new process of engaging with hospitals around their determination of need process, community benefits. So I just love to hear more from the Commission on what that relationship is like, how we can gain access to more of that funding in those relationships. I think it's really piecemeal at this point between neighborhoods and what those relationships look like. There's some good work happening through the community, well, I'm going to get it wrong, the China CHIP process, but we'd just love to hear more from you and what the counselors are thinking on that.
Yeah, sure.
So you're right, the hospitals and the health centers, the Commission, and an extensive network of over, I think, 100 different organizations are now working on the Boston Community Health Needs Assessment and Community Health Improvement Planning Collaborative. I would point you to the Board of Health's website. It's on the BPHC website. There's a link for the last 2 months, just last night. We actually went through with our colleagues, Nancy Kaysen from Beth Israel, Deaconess, and Margaret Reed, our Health Equity Director, on a prioritization process and discussion with our board members to go through the different health issues that have emerged as top concerns for residents that had completed a survey. And so the background on that work that we've been doing as the health department with the hospitals is available on our website. We've been working with them extensively. They launched this work, the collaborative, last fall. You might have been at that event. And I know that you participated in the first CHNA process. I was not here during the first CHNA process, but I think, I can tell you that we've been working closely with the collaborative in thinking through what will happen once they land on those health priorities. We have a series of conversations that we've facilitated and will be leading here at City Hall. Chief Martinez is hosting us next week to meet with and talk about the priorities at the HHS cabinet meeting, and Chief Dillon has invited us to come work with her departments as well. So there are many different opportunities that community members will be able to weigh in. I'm sorry, I don't remember off the top of my head, but you can check the Commission's website, or if we get your contact information. Happy to share 2 large community events, one at the end of May and one at the end of June, where they'll be doing this prioritizing exercise with community residents. And so I can stop there or continue, but that's a good start, I think.
And just for sake of the way we proceed, public testimony is generally for comments, not questions and answers. But that was a good question. I'm glad it was answered, and we'll move on.
Okay.
Thanks.
Hi, my name is Emily Baker. I'm a mom to 2 children, age 4 and 6. I'm a 16-year resident of Charlestown. My oldest is Sophie, and she has life-threatening food allergies, and she's touch sensitive. It's been a tough road for us growing up in the city where everything is shared and social. We have worked hard to manage it with her medical team, but she has unfortunately suffered anaphylaxis many times and other reactions that were also difficult to manage. Public playgrounds, which are our only way to be outdoors since we don't have a yard, we live in the city, have been a big challenge for us to manage. I'm writing to ask you, I'm speaking here to ask you if you would please support playground signs that would help to improve the lives of families and especially the children of Boston. There's a playground sign that's going up all around the country, including in Cambridge, that simply asks folks to eat off of the play equipment and use a water-based wipe after eating. It's a simple, common-sense safety measure, and I do think this is a public health issue. Nowadays, 1 in 13 children have a food allergy. When I spoke with other moms, this was a really common problem. I've had to leave countless times because another child was running around holding peanut butter, holding yogurt, while touching all the play equipment, asking to play with my daughter. It was really uncomfortable, it was really scary, and my daughter has had about 1 reaction a month when she's on the playground equipment. Luckily, it hasn't progressed to being anaphylactic so far, but it's been really awful and really traumatic for us. And I know that I'm not alone. So I think this very simple health measure would really make a big difference. We spoke at Parks recently about this as well.
So Emily, just to let you know, during our Parks Department hearing, several mothers came
Yeah.
with examples of signage, and Chief Cook, who is the head of the Parks Department at this time as well, is certainly looking into it and is favorable to replicating those signs. As a matter of fact, I think I was told recently that they're fabricating cardboard so that they can get up in a more immediate fashion, but then more long-term signs will be going up.
That's great. Thank you. I was there at that as well. I also just wanted to bring it to the attention of DPH. And,
Sure. Great.
Thank you very much.
You're welcome. And then I have one more, Anna White.
I don't need to because I'm an allergy mom too, and that was a great response, so thank you.
Okay, great.
And just thank you to the Department of Public Health. Boston's one of the safer places I think we could possibly live because of our EMS, because of our EMTs, so thank you very much as a food allergy mother.
Well, thank you for that. So now we'll move back around. Councilor Sabi George.
Thank you, Chair, and thank you to those of you who gave public testimony. It's always helpful to have that, and thank you, Chair, for doing it in the middle, because I think it certainly informs the conversation, the presentations. I just want to continue, Director Lupe, on some of our questions around measles, mumps, and tuberculosis. What is our protocol, or what is our response when there is a case of an active case that we know about in the city of Boston? So earlier this week, there was a case at UMass Boston of active TB. How do we respond as a city, and how do you respond as a health commission?
So in that particular example, our role, because it's City of Boston, is we follow up with the individual. So we have public health nurses who sit within our infectious disease bureau. They meet with the patient, they talk with the providers, and they do what's called contact tracing. And I'm happy to share this with you because we actually do have standard operating procedures on this. And so they do the follow-up interviews and work with the individual who has TB, and understand who else they've been in contact with, and that is our role. We make sure that they actually are linked to care, and we operate in partnership with Boston Medical Center, longstanding TB clinic at BMC. It's the largest provider of TB services in New England, and our public health nurses and a very diverse group of administrative staff help support the clinicians who are there, and in terms of ensuring that patients have access to their medication and that they're complying with the treatment that's required when you have active TB. We actually work very closely with the community health centers on that front too. If they don't want to go to the TB clinic at BMC and they have care at a community health center, and so work very closely to make sure that the medications are available in the place place that's easiest for them to access it. And happy to follow up and have a deeper discussion with you and our infectious disease team to walk you through that.
I appreciate that, and I will take you up on that offer. When we were doing some research just in my office earlier this week and the end of last week, one of the things we realized is through the schools reporting system, and I understand you're not the Boston Public Schools, but it appears that some of the reporting numbers of immunizations is very low in our schools. And I think a big part of that, especially if we're at 98% for vaccination rate, is just a problem with the data entry effort. Can we talk a little bit, though, about where do we see pockets of individuals who are not immunized, and how do we respond to that? How do we act in response to that information?
So I can tell you, there is no, because I know one of your questions was to see if we had heat maps or kind of high-risk exposures in the city, and there is no specific high-risk geographic area or neighborhood in the city. Our focus has really been working to get to that 100%, to maximize the number of individuals who are getting vaccinated. We have been working closely with Boston Public Schools and Jill Clark in particular. So our, I think you know this, but our medical director, Dr. Jennifer Lowe, has a seat on the District Wellness Council. And so we have been working with Jill through Dr. Lowe to get a better handle on the challenges that they're facing. Sometimes the documentation, from what I understand, is incomplete, so they're not able to get a full vaccine record, but that doesn't necessarily mean that the student hasn't been vaccinated.
Right.
And we're going to continue to work with them and provide technical assistance to help them get that data that they need, and vaccinations if needed.
Great. And then I know the Health Commission provides the flu vouchers or flu vaccine vouchers. Is there a way to do something similar when we think about MMR in particular, and then TB as well?
So with the vaccines, we actually don't provide flu vaccine clinics. That's actually, we might host the clinic, but that's actually OSCO pharmacy that we partner with that actually does the vaccine clinics, and they offer the vouchers, and then they do the third-party billing. So the vouchers on the MMR is actually an interesting idea. Our main focus has been in linking those individuals, all individuals, to primary care providers who can, so that they have a routine source of care that can take care of the whole self. So that really has been our focus, is partnering with our community health centers.
Great, thank you for that. And then just shifting to a response to one of my colleagues' questions earlier. We're seeing an additional investment in HIV and AIDS education on your end. Are we seeing an uptick? Because I know some communities are seeing an increase after a long decrease in the rate of HIV infection or HIV occurrence within our city limits.
So the additional funding that we have is to support the education and outreach services that we provide. We're actually really lucky in the city of Boston that we have both federal and city resources. Federal and city resources to provide that continuum of care, from prevention and outreach and education efforts, which is what we're able to do with the city resources that we receive. With this additional funding, we have actually procured $1.3 million. The additional $300,000 will allow us to have funding available in FY20 of $1,450,000 around hepatitis C virus, HIV, and STI.
And do we need that because we're seeing an increase?
I'm trying to find, do we have the HIV data here handy? I can find it. Let's see, that's the getting to zero. We have, I can get you the exact trend data. We did have, and there are outbreaks, which I think you're referring to. There have been outbreaks across the state, HIV outbreaks, and the outbreaks have been in particular, there are two that are on the larger end. So we had 6 in the city of Boston, and that's among individuals who inject drugs. And so we work in partnership with the State Department of Public Health during times of outbreak. The education and outreach funds and those additional dollars will help us with that particular population. The majority of HIV cases that we continue to see in the city are attributable to men who have sex with men, the MSM population, but we are paying attention to trends related to individuals who inject drugs. So the other piece that I was wanted to make sure that was on your radar is that the president has rolled out this priority of ending the HIV epidemic, and we can share that detail with you offline. The plan's available. They launched it in February of this year, and Suffolk County was one of the communities that was listed as one of the 48 communities that they're going to be distributing prioritized and additional resources to. And that's because these 48 cities actually make up more than half the new infections that they're seeing. Many of the cities on that list and counties are in the southeast and rural communities, but there are some large cities like Boston, which is in Suffolk County. I've been talking with the state. This is on Chief Martinez's radar as well, and I know that our board chair, Manny Lopes, had hosted a visit with Secretary of Health and Human Services Azar a couple months ago, where he continued to talk about this effort. And so this is an area where many people across the country are looking at trends in terms of the populations and increasing access to treatment therapies like PrEP, which is pre-exposure prophylaxis, and then PEP, which is the post-exposure treatment. And so we hope to be able to do more of that with these additional resources at the city level, and then obviously with the feds.
Great, thank you so much. Thank you, Chair.
Thank you. Councilor Flynn.
Thank you, Councilor Siomo, and thank you, Director, again, for taking our questions. Director, I know I've spoken to you in the past and with Chief Martinez and working closely with Heather Gasper as well. Asian American health, Asian health issues. Asian Americans, I represent the largest Asian community in Boston. They have a high rate of diabetes, tuberculosis, as we were discussing, representing 36% of all people with TB cases. Breast cancer diagnosis of Asian women is high. Screening for breast examination for Asian women is very low. I had an opportunity to talk to the president of the Tufts Medical Center about that recently. I said, you have one of the best hospitals in the world, but our women are not getting the care or the screening right across the street, so that's frustrating for me. I'm also working with Heather. We do hope to have a public health conference sometime this summer in Chinatown, specifically on Asian health, Asian women health as well. The other issue that is also a concern, I just wanted to highlight, residents have also spoken to me about difficulty of getting bilingual services for children who need speech therapists, child psychologists, this is in the Asian community, and development specialists. Hospitals often don't have bilingual providers that serve the needs of these families. I was just wondering, generally, if there's something your staff can do as it impacts the Asian community on services for communication, language access. All those are critical. I met with the Asian Task Force on Domestic Violence, and they said their biggest issue is language access. So making sure that we're able to speak to people in a language that they can understand is critical. But just wanted to get your thoughts on what we can do, or are we doing enough for our Asian community?
So thank you, Councillor Finn, for going through all the wonderful progress that we've made in partnership with you over the last year since we were last here in front of the city councilors. And I also want to thank you for the leadership that you've taken, advocating for and bringing to light all of the challenges that our Asian American community in the city of Boston are facing. As an Asian American woman, I find it particularly refreshing that you've really taken this on in a very serious way and have pushed us to be more accountable, because having small numbers in the data and not being reflected and just having an asterisk is clearly not acceptable. So I want to thank you for that, because we have made some amazing improvements on the data side. And so I want to thank you.
Thank you.
Both professionally and personally for that. On the issue or challenges of cultural competency and linguistic and cultural competency and care, what I can share with you, we're lucky that we have so many, I'm going back to the health centers, South Cove, but it shouldn't just be South Cove that is in Chinatown. I know that many of our health centers have that kind of linguistic and cultural capacity among their workforce. In terms of the Health Commission, we do provide and prepare as many materials as we can in our top languages. So with the Asian languages, definitely in Cantonese, Mandarin, Vietnamese, those I believe are the top Asian languages spoken in the city of Boston. So in terms of the health education materials and the prevention materials, and ensuring that they are in the languages that our residents read and speak. That's a priority for us. And then I think what we can do offline is follow up and see through our Community Health Education Center. We provide community health worker training, the CHECK program. And we're part of the certification process that the State Department of Public Health has in place for community health workers, who oftentimes work as patient navigators and outreach workers for communities, very diverse communities. And so we can find out and see if they're doing anything specific around patient navigation and building that workforce throughout our different healthcare providers, both hospitals and health centers. But I certainly think that there's still a lot of work to be done, particularly when so many of our residents are immigrants and we're a majority minority city. So thank you for your leadership for the Asian community.
Yeah, thank you, Director. And I just want to say that Heather has been excellent working with me and my staff in providing great resources. So I do enjoy working with her. So I just wanted to pass that along to you.
Heather's wonderful.
Thank you, Director.
Thank you. Councilor Campbell.
Thank you, Councilor Siomo. Just picking up on something that probably was discussed earlier when I stepped out, but if not, Councilor Flynn and I hosted a convening roundtable with those doing work in the domestic violence, sexual assault space based on a hearing order we filed last year, and then we refiled this year. And before we have the hearing, which will probably happen in the fall, we wanted to pull together these providers to listen. And we had Northeastern Law School, which has the domestic violence clinic, host the conversation. It was powerful. It was about 2 hours long. We probably could have stayed for another 2 hours, just listening to the barriers, the problems within the various systems that survivors have to engage with, and how challenging it can be, the shelter system, you name it. Some unfortunate incidents that happened with BPD, and most of them talked about how great BPD is, but occasionally, there are complaints that come up and how our response could be better. So we just we took a lot of notes, but obviously, given the work of the Health Commission with our health centers, hospitals, you name it, and of course with other city agencies, curious what the Health Commission is doing in the space of domestic violence, sexual assault. And one additional layer that we talked about that probably doesn't get the attention it is due, which we want to make sure that we talk about, is abuse of children, sexual abuse, and how it's very much connected to those who at some point become what we label as perpetrators. And so curious what you're also doing in that space as well.
Mm-hmm. Thank you for that question, and thank you for hosting the discussions around an important issue, such an important issue. I know
and for the formal hearing, by the way, we of course will be inviting the commission to be a part of. This was just step one.
Yeah. So thank you, and I know that Councilor Flynn. I talked about the Family Justice Center, and I know that Councilor Flynn got to come and visit sometime in March and was able to tour the programs. I don't know, Councillor Campbell, if you've come and visit
No,
Henry
I
Delaney and the
can't.
staff. So we should definitely host you and invite Councillor Flynn to come back because it is really a great way for you to see the different resources that are available. And not just from the commission, because it really is multiple, it's multi-jurisdictional and multiple agencies, both city and state, that are under one roof, and the compassion and care that they provide, even to the youngest. And so one of the programs that's housed there is our sexual assault nurse examiners program, which is actually a program under that's under the Department of Public Health. It's a pediatric SANE program. Even the physical layout of the space, so the interview rooms for adults and children who are victims of domestic violence or sexual assault are details that unfortunately they have to pay attention to. So the programs that are related to DV, sexual assault, really are housed within the Family Justice Center. Happy to host you. There are a couple of different programs that and numbers that the staff wanted me to flag for you. So in addition to counseling and the legal services that they offer, they do, I mentioned the pediatric SANE, which is the forensic medical service. They connect to shelter, refer to different treatment. They do safety planning. So this isn't just one organization, but multiple organizations working together under one roof. Unfortunately, the number that they served in 2018 was over 5,000 new clients, and this is in addition to the ongoing and existing clients. They do a host of trainings, so everything from domestic violence, sexual assault, human and sex trafficking, crimes against children, and economic empowerment. And over nearly 1,200 professionals have attended those trainings. That's just last year alone. They've done various trainings and curricula. There have been conferences that they've hosted. So in FY19, they wanted me to make sure that you were that I had raised awareness around the Beyond Exploitation Girls Conference that they held. So this was hosted by My Life, My Choice, and the Child Advocacy Center's SEEN program, so Support to End Exploitation Now. And they also have held career preparedness for exploited youth and young and adults. And so I forgot to mention, in the Family Justice Center building, they have Dress for Success Boston, which is another resource. And so I could go on and on, but
I will
really
follow up.
We'd
yeah.
love to host you and Councillor Flynn for a visit.
And just lastly, I would love, and this can be via email, any data that you have with respect to incidents of not only the number of clients that their center is seeing, but any data you have with respect to incidents what in DV, sexual assault, crimes against children would also be extremely helpful.
Okay.
Thank you,
And
Councilor.
if you want to include me, since it's in my district, I'll take you to lunch. Councilor Asabi George?
Thank you. Thank you again, too, for being so thorough and thoughtful with your responses to all the questions of my colleagues. I've taken some wild notes here. My one question, and this follows up on Councilor Flaherty's question earlier about the community of origin for many of the guests who come to either Woods Mullen or Southampton Street for the shelter. Last year's budget hearings, during the presentation by Chief Dillon, she noted that the number was about 60% of those that present themselves at our shelters are not from the city of Boston. Do we have an updated number?
Not sure if I have an updated number, but I remember in looking at the notes, I know it was high.
Yeah,
It's
I
the
worry because my first budget, FY17, and this time in 2016, we were at about 40%. My second budget, we were at about 50%. Last year, we were at 60. So I worry about that trend, and I wonder if it's something real that we're seeing. We know that homelessness is a real problem in the city of Boston and something that we need to respond to, and it's not about not taking care of people from other cities and towns, but I think we need to have a better understanding actually, I think it was Councilor Zakem who advocated for the invoicing of some of these other cities and towns, which I've asked for in the past. I wish we could do it. I think there's a way that we might be able to do that, especially through the state, but it looks like you may have found some of that data.
I'm looking here, and actually the new number, it's not on here, but I know that 60% is the number that the staff have mentioned. We can confirm that for you, so you have, up to date.
Great, and if you would also share the updated community of origin data. So I have a breakdown, it's probably almost 2 years old
Okay.
now, of where individuals are coming from or what their community of origin is considered. And some of it's states, some of it's cities.
It is surprising how many come from New Hampshire. So
Yeah.
I know that that is another out-of-state, that's a state that frequently pops up
Right.
because they literally will send them. Jerry Thomas, our bureau director, has shared stories where, very complex medical needs, where they're sent on a bus to the shelter. So that is not uncommon. So, but we can get you the county or community of origin, state of origin.
That would be great, thank you for that. And I know that in your presentation, you discussed some of the improvements to the shelters. In particular, we are increasing the bed capacity from 200 to 222 at Woods Mullen. Has that been done, or is that in the planning for FY20?
That's been done
That's
with
been
the
done.
renovations on the second floor, so that's been able to expand it so that overflow.
And I've seen those renovations, and
Yeah, you were there at the
it
ribbon
really
cutting,
is
it's
a impressive job, work that was done there. I know that what we're also finding, so we have this bed capacity issue, and when we hit that 222, especially in the cold months, that many of our guests are either placed in a chair or on a mat. We talk a little bit about the overage numbers, especially in those colder months, and then what we're expecting to see is someday the heat might come.
Right, well, no woman is turned away from Woods Mullen,
Right.
so if someone comes in and that we have a chair, we will make room for them. So, but you're right, it is complicated when we run out of beds, because we did reconfigure the second floor to make more beds, which took away some of the mat space. But overall, I think that's beneficial to the ladies so that they're not on mats so much. We are still trying to figure out what to do with the winter overflow. And now that we're going into, especially with climate change, the summer months, how to make sure that the ladies are cool and not becoming ill from the heat or the cold. So we're still struggling with this, and we're not quite sure what the solution is, because where the ladies go during the day, it is the primary staging ground, I guess. It's like their living room. We've got the televisions there, we've got tables, we've got some case managers. So we are limited with space, but we're continuing to look for additional options for them.
And this is something that we work on in partnership with the entire shelter system in the city, but it is, as Grace has pointed out, a challenge.
Yeah, and I know last year there was some conversation about a guest advisory committee.
We do have a women's advisory committee who I know that Jerry convenes regularly, and they give feedback on improvements, ideas for programming and resources and services that they need. So that has been a big improvement that Jerry's really been leaning on.
And that happens both at Southampton Street for the men and Woods Mullen for the women?
I can tell,
Yes.
yes, okay. I know
Yes.
for Woods Mullen, definitely. So for Southampton?
They've stood one up at both shelters, and this month, actually, there's an art program where art will be rotated through the shelter, and the women are actually going to view some art and try to pick some new art to go up to just more.
Great.
Make the space.
Just make this space a
More
little bit nicer.
comfortable.
What's the average night stay at both Woods Mullen and Southampton?
Okay, average night stay. So we have here, we have the daily census.
What's the daily census?
The daily census for, let me just see. There was a slight increase in 2018, 1.5%. So the average daily census at Woods Mullen was at 229 in 2018, and for 112 Southampton Street, it was 481. The census data in terms of average point in time that individual guests stay in the shelter is not here in the data, but I can provide that to you afterwards.
That would
For
be
both
great.
shelters, Counselor?
That would be great to have.
Okay.
And then I'd also like to have, if you could add to it, because I don't know if you have it handy there, is what the average cost per night is to shelter an individual.
We'll have to, we can get that
Great,
to you.
thank you. My time's up anyway, so I appreciate that. Thank you.
Counselor Flynn?
Thank you, Councilor Siamo, and I just had one question, Director. Can you talk about your outreach, public health outreach to residents in public housing on food, nutritional programs, any type of public health assistance services that we are providing to our BHA residents? I represent a large number of residents that do live in public housing, and I know you do great work in public housing, but can you highlight some of the programs that you do have?
We have done some great work on chronic diseases. So ISD, every year, ISD, and I think it's coming up actually in the month of June, ISD and BPHC do a joint annual training day for our inspectors. We talked a little bit about that relationship with ISD when it came to lead in schools, but we work hand in hand, and also BHA is there too. We work hand in hand with Director McGonigal on a whole host of different activities. Just a couple of years ago, they really were. We partnered with Director McGonigal's team to roll out smoke-free housing.
Okay.
Across all of the Boston Housing Authority's sites. The previous administration, and now he's running in that big pack of Democratic candidates, Secretary Castro came to Boston to actually announce that the BPHC smoke-free housing policy was one that was going to be instituted across all of HUD, which was really exciting to have him here and do that announcement in Roslindale. And so we've worked with them on the smoke-free housing. We have also worked with them in different ways on food insecurity. So through, I know they hosted us when we were wrapping up a federal grant called, it was the Partners in Community Health, but it was Let's Get Healthy Boston. And we had their help in ensuring access to water at their different meetings at the Boston Housing Authority and not having diet sodas. And so that's actually something Bill gives me a hard time about because the residents come to the meeting with water instead of his Diet Coke. And so there are a whole host of things that we do in partnership with them, and we're happy to package it for you so that you're aware of the different things. And if you have suggestions, would happy to meet with you and talk through how we can continue to strengthen that partnership between us and BHA when it comes to food insecurity and increasing access to healthy food.
Yeah, thank you. I think that's excellent. And I think almost every development does have a BHA Unity Day for the summertime.
That's right.
And so it might be an opportunity to partner up with BHA on, being present and providing some services. I do know you do provide that type of outreach, and I know it is helpful to the residents. So just want to say thank you, Director.
Okay. Thank you.
Thank you.
Thank you.
Counselor Savage.
I guess I do have one more question. This will be my last one for today, because we could go on forever. The engagement center located behind Southampton Street, can you give us a little bit of an update on the status of the engagement center, some of the success, or should I save that for?
You can save it.
I'll save that for, I'll save it.
They're going to be here shortly.
Yeah, so I'll
after-
just save
okay.
it for the Office of Recovery Services. Then, otherwise, I'm done. Thank you, Chair. Thank you
great.
both.
Thank you.
Director, thank you very much for today's testimony. Just in advance of next week's EMS, just to be prepared to send us in advance the response times and, yep, thanks, Jim's got it, and the FTEs, maybe a 3 to 4 year historical documentation. Thank you. Again, thank you for all the great work that you do responding to crisis, but also preventative programs that are, I think, a model for our country. I want to just thank you for that and your entire team here and in the field. I want to thank you again. Before I do close, is there anybody else that wish to testify before I close out today's hearing? Seeing and hearing none, I want to thank you again. This hearing is adjourned.